Now, as a physical therapist, I commonly see many adults who experience traumatic falls. And part of my job is focused on teaching these individuals strategies on how to prevent future falls from occurring. However, sometimes it's inevitable, and falls can still happen because of the various factors that can be involved. Falls can be caused by weakness or instability from a previous injury or surgery, side effects from a medication you're taking, pain, or even just being fearful of falling from a past experience. This is why I believe that it is critical for every aging adult to know exactly how to get up from a fall, especially when no one is around. This will not only improve your confidence, but will give you the reassurance that you know exactly what to do if something like this happens. Now today, I wanted to share with you the 4 different ways you can safely get up from a fall without help. Now before we get into these 4 strategies, we need to discuss the first actionable steps that one should take when a fall does occur. Step number 1 is calling for help when available. For major falls, that unfortunately may mean calling 911. Or for minor falls, this could mean using a close bystander who is around that can help you up. The fact is that if you have access to help, then use it. Now, step number 2 is assessing how you feel. When a fall does happen, it's important that you're mindful of how you're feeling. Do you have pain? Are you experiencing any dizziness? Are you experiencing any lightheadedness? These signs can tell you if you've actually injured yourself or if something else might be going on. There's no reason to rush to increase the likelihood of you falling down again. Give yourself a few minutes to regroup before you think you're ready. Now, the last step is to pause and breathe. Take a couple slow breaths to help relax and calm your emotions. For some people, falls may feel insignificant, but for others, this can be a traumatic experience. If you are one who is experiencing emotions of shock or anxiety, take a few minutes to practice deep breaths, inhaling through your nose and exhaling very slowly. This will allow you to prepare your body and mind for getting back up off the ground. Now that you're aware of what steps to take after a fall, let's get into the 4 different strategies for safely getting up off the ground. Now, with all of these strategies, you will notice that I start from my back and transition to my hands and knees. Starting with the first strategy, this will require a lot of upper body strength. You will start by extending your legs backward while bringing your hips up towards the ceiling. Then you will slowly walk your hands closer to your feet until you come to a standing position. The next strategy will require more hip flexibility. You will start by bringing your stronger leg in front of you while still steadying yourself with your hands on the ground. You can also place one hand on your thigh to assist. Next, you will use both your front and your back leg to push down into the ground to come to full standing. The third strategy will be helpful if you have a bench or an object you can lean on close by. Once you transition to your hands and your knees, you will have to crawl to the object to support your forearms. Similar to the previous strategy, you will bring one leg in front and shift your weight forward on your forearms. Then you will push into the ground with your front leg and come to a standing position. The last strategy we will discuss will require you to roll over to one side. One leg will be positioned in front of you while the other leg is planted behind you. Once ready, you will lean your weight forward on your hands while sweeping your front leg behind you. Then come to a standing position. Now, because there is no one way to properly get up off the ground, I wanted to provide you with a few different options that can work for anybody. Most of you will likely only use 1 or 2 of these options. We are all different sizes and have different strengths, which can greatly determine which technique you decide to use. Now, if there is another way that has worked for you that I did not cover in this video, please share your experience in the comment box below. In the meantime, if you found this video valuable, please consider liking and subscribe to the channel to allow me to continue making videos like this. Thanks for watching, and I'll see you in the next one.